Well, Doctors Without Borders in the Tigray region north of Ethiopia are raising concerns over a looming humanitarian crisis. They say if clashes continue, hundreds of thousands of people will be affected and parts of the country will be increasingly unstable. Doctors are providing medical care in Sudan to people fleeing the violence in Ethiopia. For the latest on this, we are joined by the head of the mission in Sudan, Khartoum Jean-Nicolas Dangelser. Very good morning to you. What is the situation there? What are you seeing?
At the moment, what we see is dire conditions for people that are crossing the border into Sudan, whether it is in the transit areas where the people are crossing the border, or in the official camps that are set up by the government. The humanitarian response is slow to scale up, and people are really suffering for poor services available.
What are they suffering from? I know a lot of them have obviously gone through an incredible amount of trauma. Did they tell you what they saw, what they were witnessing, what they just experienced?
Indeed, one of the things that strikes us most since the beginning is the mental health status of the people. Indeed, a lot of trauma. A lot of them are talking about the shelling and the bombing that they experienced, and the hard journey that they have to achieve to reach Sudan. In the transit area and in the camps, the problem is that there is a lack of shelter, not enough food, and sometimes not enough water for the people to be able to have a decent life on this side of the border. So this is the major problem.
All right, so those who are lucky enough to have escaped, what are their needs now from a medical point of view, and how easy or hard is it to get the medication needed?
So at the moment, the people that we are receiving on the Sudanese side of the border, their health status is quite okay, apart of a few cases of malnutrition and a few cases of war wounds. The people are more mentally affected, but what we are hearing is that in case the rest of the services are not scaling up in terms of shelter, water and food, that then we are going to see a deterioration of the health status. So for now, the major issues are actually to solve the food and the shelter, for example, because already some people are returning back, even though it's dangerous for them because of the conditions that they find here in Sudan.
I know MSF, Doctors Without Borders, I mean, you always work in so many countries that have been badly affected by the cruelty of man, war. I mean, what are you seeing today, if you can compare it to anything? How worried are you of the condition and the state of the people and the status of the fighting on the other side?
So what we are worried is that the situation is then getting anchored into time, and that we would see then a deterioration of the health status of the people, because they would have to find longer journey and harder journey to reach Sudan. And in case there is some people that are getting enclaved, this is where we are going to see a deterioration of their health status. What is worrying at the moment is especially the people that were under HIV and TB treatment, that are cut off from their treatment, and are now really suffering from that, and this is also a major health issue at the moment.
All right, let's leave it there. That really dire situation still playing today in Ethiopia and Sudan. For taking those people on MSF, Jean-Nicolas Dangelser, thank you very much.